Medtronic has introduced a series of new pump connectors, the 8576 for vascular applications and the 8575 and 8577 for intrathecal applications. The procedure for using these connectors differs from the procedure previously used with the 8700A and 8700V vascular catheters and the 8709 intrathecal catheter. The following instructions for use should be carefully followed. 1. For ease of handling, ensure that gloves, pump connector, and catheter tubing are as dry as possible. 2. Insert the catheter tubing into the strain relief sleeve of the appropriate pump connector. 3. Push the catheter lumen onto the tubing connector pin. Be careful not to puncture the catheter tubing with the tubing connector pin. 4. Compress the strain relief sleeve and the catheter while pushing forward. Release and repeat the pinching and pushing motion until the catheter is flush against the tubing connector hub. 5. Rotate the pump connector to verify the catheter is on the tubing connector pin correctly. 6. Place a non-absorbable suture in the groove on the strain relief sleeve over the catheter to prevent the connection from separating. 7. Before connecting the pump connector to the pump, verify that the pump is functioning and the catheter and pump connector are patent. For more information, refer to the appropriate Medtronic neurological pump and catheter technical manuals. 8. Firmly press the pump connector onto the tapered metal pin of the pump with a slight rotation motion. The pump connector snaps in place. 9. Secure the pump connector with a non-absorbable suture placed in the suture groove at the base of the connector.